State matters of the lawmakers, because the Gambian lawmaker has on Wednesday called for more investment in the country's fragile health sector as the National Assembly discusses President Adama Barrow's State of Nations address delivered last week. And let's have more details of that in this report.
The Gambia is one of the poorest countries in the world, and the country has a fragile health system, further ravaged by the coronavirus pandemic. Before the coronavirus arrived in the country in March this year, poor people's access to public health care was limited by a lack of drugs and, in many cases, the lack of ambulances or fuel for ambulances. Blood transfusion, which is in very high demand, is scarce, and women and children died during childbirth or shortly after. Today, many of those seeking treatment in public health facilities are given scripts for drugs that they have to buy from private pharmacies, something which is quite expensive for ordinary Gambians. Last week, President Adama Barrow said his government remains steadfast and dedicated to providing affordable and quality health care services, particularly in times of hardship or calamities. When National Assembly members began discussing the president's speech on Wednesday, Honorable Ndeyasin Seka, a nominated member, said it was important for President Barrow to be able to tell how problems in the sector will be addressed or are being addressed.
I admire the President coming to this National Assembly to deliver his address. But I would love, before coming to the National Assembly to deliver his address, let him, what is wrong with him paying visits to the departments to see what is happening? Sometimes cut and paste, sometimes are issues, and we should really do away from those things. I admire everything he said. We have a lot of problems, but what are the strategies to make sure that we overcome those constraints? Those are the issues. We cannot say that everything is going right. No. Especially we know that we are in this transition period.
Honorable Seka's position was supported by the National Assembly member for Talinding, who added that the country's health sector needs more investment.
On the women and social protection, Madam Speaker, I think a lot needs to be done. We have a lot of infant mortality. If we want our health sector to be attractive to the investors, I think more need to invest in our health. A lot of women are dying, and therefore I think the government should do something to see whose negligence such occur or to attract our health system.
Despite efforts by the previous and the current government, the country's health system is still under great pressure and is struggling with infrastructure, equipment, drugs, and personal problems as qualified nurses and doctors look for better paying jobs in private healthcare or abroad. For Africa TV, I am Daisy.
Lawmakers in Banjul calls for more government support in the country's health system.